So in today's video, we're talking about endometriosis. But before we go into this topic, what is endometriosis? Hey guys, welcome and welcome back to the channel. It's your girl Pep. I'm a registered nurse BNSC, and on this channel we'll talk about nursing, lifestyle vlogs, feminine health and everything in between. And if you're just setting your eyes on this beautiful face, please don't make this last by clicking the subscribe button down below. And with that being said, let's get right into this video. So endometriosis is a disease in which tissue similar to the lining of the uterus grows outside the uterus. This tissue becomes thick and breaks down during each menstrual cycle. But because there is no exit point for this tissue, it then becomes trapped, leading to severe pain during periods and of course fertility issues. So this condition can sometimes be mistaken for pelvic inflammatory disease because it is associated with so much pain. Now that we know what endometriosis is all about, what are the common signs and symptoms? We have painful period, pain during sex, infertility, painful bowel movement or urination during period, excessive bleeding during period or between periods, fatigue, diarrhea, constipation, bloating or nausea during period. So what are the causes of this endometriosis? So just like most of these female reproductive diseases, the cause is unknown, but it can be linked to series of events. The first is retrograde menstruation. What is retrograde menstruation? Retrograde menstruation is when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity, at the same time flowing back out of the body through the cervix and vagina during periods. So in this process, endometrial cells are being deposited outside the uterus where they can implant and grow. So next is surgical scar implantation. So maybe during hysterectomy, C-section, endometrial cells may attach to a surgical incision, leading to endometriosis. So what are the complications of this endometriosis? We have infertility and ovarian cancer. So if you want to know more about ovarian cancer, you can drop a comment down below. I'll make a video on everything about ovarian cancer. Now that we know the complications, the causes, the signs and symptoms, how do we treat this endometriosis? Like, you might have a sister or a friend that's been having one of these signs and symptoms and is worried or want to know the permanent cure to this disease. But unfortunately, there are no permanent cure. Treatments to manage endometriosis can vary based on severity of symptoms and whether pregnancy is desired. Number one is pain management. So just like I said, endometriosis is characterized with severe pains. So to manage these pains, most of these individuals are being placed under NSAIDs and analgesics to calm this pain. So next is hormonal therapy. Hormonal therapy can include GnRH analogs and contraceptives like pills, implants, injections, etc. For this set of people, they probably are not worried about getting pregnant at that time, so they just face the hormonal therapy aspect of management. Next is fertility treatment. So for the persons that are concerned about getting pregnant at that time, they would rather go for fertility treatment. Next is surgery. So this surgery is just to remove endometrial lesions and scar tissues and adhesions. So at the end of the day, it depends on you to choose the preferred treatment plan, but it is best you discuss your treatment options with your healthcare provider and see the one that you are most suitable for. This is the end of this video, guys. If you find this video very helpful, do well to share this video, click on the like button, subscribe if you haven't, and I'll see you in my next video. Bye guys.